So I want you to start educating your friends that obesity is a real condition that needs help. Okay. So most of you who have weight issue would understand that the other chronic conditions that you have, so let's say diabetes, high blood pressure that you know of. So what is a common theme in this condition? So the common theme, heart disease, thyroid, exactly. So the common theme in this condition, there's no cure. It's an ongoing management. If you don't treat them, they get worse. They go up and down. Some days are good, some days are bad. They always have complication if you don't treat them. Your active involvement is needed, right? And you need to get a professional help. Yes. So all of these things requires a constant struggle, constant patient involvement, constant involvement of yours, and constant involvement of healthcare providers, and it needs treatment. So obesity is exactly the same thing. So it needs education, and that is why you're here. Next, what else is needed? Your active involvement, self-monitoring. So when a person has high blood pressure, what do? They check their blood pressure, they bring the log. So self-monitoring for weight would be what? Counting your calories, counting your steps, looking for your portion size, at least once a month or once a week, standing up on a scale, because that's the thing that will keep you on track. Not every day, please, no every day, not 5 times a day, but at least, some realistic goals. So self-monitoring and self-management. So when a person of COPD have flare, he has his action plan. He knows that I need to increase my puff from 2 to 3. I have to start taking my antibiotic, which is available at the pharmacy, and call my family doctor. Same thing with self-management for you guys. So when you see 5 pounds up from your weight, you should be conscious, right? So self-management, so active meal preparation, active involvement in food purchases. So that is needed for this. So do you all agree with this? Does it make sense to all of you? Change the lens. That's the way I want you. And don't forget that it needs regular follow-up. That's why you will hear me saying, are you ready to go for a 2-week follow-up? Are you ready for 3-week follow-up? Because it needs regular follow-up. So that's the mistake that we professionals were doing for our weight patient that say, goodbye, see you later, alligator, and never follows up. So every month, every 3 months, so we, common ground plans need to, and in the end, you need to utilize your resources because it's a new concept. So either get an individual help or a group help as you're getting, virtual versus in person. There are a lot of help available in the community, hospital. Some people for their chronic disease go for spiritual help, and that's okay. That works. And some people go for non-spiritual help. So that's okay as well. So I want you to start looking into that. And then the help is needed for both patients and caregivers. Right. So the current definition of obesity, according to the Obesity Medical Association, which is the main governing body that comes up with the guidelines, obesity is a chronic, progressive, relapsing disease. Relapsing, see? Up and down, which has a multifactorial neurobehavioral effects. And what is happening in obesity? There is an increase in fat cell, which is in adipose tissue. And that adipose tissue should cause a dysfunction in sense of metabolic, psychological, and mechanical dysfunction. So if people who have big adipose tissue, they're big, but if they do not have any metabolic, psychosocial, or mechanical dysfunction, they're not diseased. Let's put it that way, right? So does that make sense? So it's not about numbers. It's not about fat. It's all about, is this fatty deposit causing you a problem? Then that is obesity. Then it's called a disease. Obesity is a chronic, progressive disease, requires long-term follow-up. So the habits that you develop, you need to keep doing it. Okay? We as a human, we are just programmed to gain weight. That's how we are. There's no cure. It's all about management, right? And the treatment is all about whatever it's in our hand. So if we can change our behavior, right? Yes, now we know from past 5 years that now we can change our hormones. So maybe we can change bit of our genetics with the medications. That's what we're going to talk about. So main thing for us is making sure we keep the weight off. So whatever we are now, think about maintenance. The next stage, the first thing is all about maintenance. Weight loss comes next. Weight loss is not first. Remember the scale. The scale has to be balanced before you take the things off. So it's all about maintenance. If you have been gaining weight 10 pounds every year, your first goal is not weight loss. Your first goal is what? Weight maintenance. So in the end, the conclusion is obesity is not an issue of willpower. It is a real disease.